The patient question says that I get periods every month, but I do not have a specific date. The date keeps changing every month. Sometimes there is a difference of 15 days, like the periods get delayed for 15 days or so. It makes me worried. I have not visited a doctor yet. Kindly advise.
Right. So I'm going to give a generic answer because obviously we need a history. We need to know the patient. We need to know the age of the patient. But firstly, having a clockwork regular cycle is a myth. When people tell me my cycle is a perfect 30-day cycle and I get it exactly on the same date every month, you can't, because there are months when it's 30 days, 31 days, 28 days. So as long as there is a reasonable regularity, you are fine. It's okay to have a frequency of maybe somewhere between 24 days and 34, 35 days. It's extremely important for every woman to keep a record of her menstrual cycles. Either you do it in your diary, you do it on a calendar, or today you do it on the number of apps available to you. If you're concerned and if you're bothered, then it would be a good idea to get in touch with your doctor, your family physician, or your gynecologist and ask if there are any reasons why the periods are irregular and if anything needs to be done. I would normally allow, say if a young girl comes to me and she's an adolescent, 15 or 16, and she comes with her mother and tells me she's got irregular periods and they're delayed, I would reassure them and tell them that as long as there is reasonable delay, we don't need to do anything. What is reasonable for me? I'm not happy if someone is delayed more than 4 weeks. That means 2 months from your last period. I know there are women who get their periods every 3 and 4 months, and that bothers me, and I'll just tell you why briefly. I'm not happy with very short periods when they are less than like 20 days, though there will be a time in a woman's life, particularly when she is in the perimenopausal years, in her early 40s, where one of the commonest patterns is the cycle becoming shorter. Now, what do you do if the cycle is shorter? Well, firstly, you reassure. If they're extremely delayed, we make them come with a very short course of medications called progestrogens. After that, we sit down and decide whether we want to regularize the period somehow. We could regularize periods extremely well with the birth control pill, which is given cyclically, though it can be given extended. I'd like to share a very interesting development in the birth control pill. You don't need to menstruate every month. In fact, in the US, they now have a concept called seasonal, where a woman menstruates once every season. Now, having said that, a very irregular period may be signifying a hormonal disturbance. A very short cycle may mean that now the ovaries are not functioning the way they should be, and there are certain hormone tests, AMH, which talks about ovarian reserve, FSH and LH. And remember, ovaries can fail even in very young women. If periods are delayed, then I have another concern. Not so much the delay, but the fact that the lining of the uterus becomes thicker and thicker, and it starts when she finally bleeds, that very thick endometrium can lead to very heavy periods. In that situation, I would like to do something for her to kind of bring that period to a reasonable duration so she sheds regularly and she doesn't land up with hypoplasia. Endometrial hypoplasia over many years might lead to a risk of uterine cancer in later life, which is why it should not be disregarded. And finally, we've got amazing new techniques and technologies for women who don't want children and women who want to protection as well. I mentioned the birth control pill. We even have an intrauterine device which releases progesterone. And we even have an implant which releases progesterone. And interestingly, with these, your periods will be irregular or stop, but having irregular periods or no periods with the device is good. On your own is not good. And finally, if she wants to conceive, this woman may not be ovulating and would need to take medications to induce ovulations. So the approach depends upon where you are in life. The approach usually is conservative. Your keeping a diary will help us out by keeping a record and deciding whether it's good, bad, or not. It could be managed very easily by giving you progesterones few days a month, putting you on the birth control pill, inducing ovulation to have a pregnancy, or finally putting you onto an intrauterine device or an implant which protects you. So be judicious. Don't panic by everything you read about irregular periods and heavy periods on the internet. I think your doctor is going to be your best resource.
Thank you, sir.